Jen. Here we go. Good evening, and thanks also to Marilyn, who didn't name herself, but put that video together. And thank you for taking a moment to sit with that. The lives that we just saw, they're not statistics. They're the reason we do this work and the reason we're gathered here this evening. Give me just a moment, and I need to share my other screen. All right. Good evening, everyone. My name is, I actually think I recognize everyone who's on this call already, but I'm going to say it anyway because it was part of my plan. My name is Karen Herron. I'm the Executive Director of Marylanders to Prevent Gun Violence. And I appreciate the fact that you are here this evening and taking the time to engage in this conversation. Tonight is our Advocacy 101, and I want to start by saying that this event is designed for people that are new to the legislative process and for people that have been doing this work for years. So if you're anywhere in between those two things, you are exactly where you are supposed to be. Bear with me on the technology because it's the part that I am least comfortable with when it comes to slideshows, but I think we're good. Okay. The goal tonight is to give you some clarity, not to overwhelm you. Over the next hour, we'll start with a snapshot of gun violence data and trends in Maryland. Then I'll walk you through the legislative process and how it works in Annapolis at a high level. From there, we'll focus on what our priority bills are for this session, what they do, where they are right now, and why we're focusing on them. We'll close by talking about concrete ways advocates can get involved, recognizing that people have different comfort levels and different amounts of time. So, time permitting, we'll be able to answer a few questions along the way. This is not a policy deep dive or a technical training. You don't need to remember every detail. If you leave tonight understanding where we are, how you can help, then we've done our job. Gun violence prevention advocacy can feel intimidating, especially if you're new, and frankly, honestly, even if you're not. The system is complex by design. Our goal is to make the process feel more accessible and to make it feel more human. We are often asked why advocacy matters, and this question feels especially urgent right now. We are living in a time through a period of real political turmoil. Democratic norms are being tested, institutions are under strain, and a lot of people are feeling overwhelmed or powerless in the face of it all. Advocacy, however, is the opposite of disengagement. It's a form of peaceful democratic resistance, choosing to participate, to speak up, and to insist that our laws reflect evidence, shared values, and care for human life are all very important ways of making sure that democracy prevails. And in the context of gun violence prevention, advocacy matters because progress doesn't happen by accident. Reductions in violence are the result of a sustained effort, policy change, public health strategies, and community investment working together over time. Advocacy is how we make sure that those gains are protected, expanded, and grounded in evidence, not rolled back or left vulnerable to political shifts. That's why tonight matters and why your engagement in whatever form that it takes actually makes a big difference. So I'm going to stop sharing right now. Hold on one second because I need to make sure that I am going to give someone else. We'll just try. Jen, you may have to ask for permission. Let me do a little introduction first. So to ground us in where Maryland is right now, thanks. I'm really grateful to be joined tonight by Jen Polyankonis, the director of the Maryland Center for Firearm Violence Prevention and Intervention. The center is housed within Maryland's Department of Health and plays a critical role in understanding gun violence as a public health issue. I will turn it over to her right now, and she's going to walk you through some data and trends in what we are seeing.
Oh, hi everyone. It is really great to see all of your faces. Debbie, I see you, and this is going to be a little taste of Saturday's discussion, but just a little bit. Um, as Karen said, I'm Jen Poliukonis. I am the director of the Maryland Department of Health Center for Firearm Violence Prevention and Intervention. And we center our work around the public health approach. In fact, we are legislatively required to develop the statewide public health approach to addressing gun violence. And this is just a little bit of a cycle that I like to show that to really describe what that public health approach means. I think sometimes people think there's public safety and then there's public health and that they're totally separate. But in reality, public health is just about doing research and looking at statistics to understand the scope of a problem, whether it's gun violence, whether it's COVID or any other communicable disease, and then trying to find solutions based on that that are going to reduce whichever disease the community is being impacted by, and then starting that cycle all over again. But the most important thing about the public health approach is the belief in prevention. It's not just about, trying to enforce something after the fact. We're trying to develop solutions that are going to save lives in the first place. And that's why I have always really been drawn to it. We focus our work on three main areas. One is prevention and assessment. So thinking about those policies and programs that can stop gun violence before it happens. So for instance, advocating for many of the laws that you're all doing this time in the legislative session, trying to pass laws to strengthen domestic violence, protective order firearm surrender. Those are some of those strategies, strengthening extreme risk laws, developing strategies related to safe storage to prevent young people or those who are prohibited or those in crisis from accessing guns. And then there's intervention and response. And I look at this framing almost as harm reduction. So people have access to guns. There is a conflict that is escalating. How can we mediate? How can we support them with wraparound services to prevent that harm from escalating and to keep them out of harm's path moving forward? And so this is going to be community violence intervention programs like Safe Street and ROCA, and lots of other models that we have here in Maryland and in states across the country. So when I think about that, I really think about those direct service programs. And then the third one is community resilience and healing. And we know that gun violence exists in a really complex ecosystem, and there's not just one cause. And then, so there's not going to be just one solution. And some of that is going to be thinking upstream and addressing those root causes, and also supporting victims and survivors, so that we can prevent recidivism and we can make sure that people get the help, both mentally and medically, that they need on their path to recovery. If you want to learn more about our center, you can read our preliminary state plan. This goes over some of our top goals and objectives, including creating a needs assessment around the state. We want to make sure that as we develop that long-term statewide strategic plan, it's being informed by more folks than just me and by those of us at the Maryland Department of Health. We are working to enhance data, and I'm going to talk a lot about data tonight. So I'll delve into our firearm violence data dashboard. We are working to create collaboration between agencies and break down silos. And so when I say that we're going to create this statewide approach, it's not just for my office, but it's to make sure that the Department of Juvenile Services, the Department of Education, that the Department of Labor, that we're all working together to address this issue. And of course, investment. We actually have a funding opportunity out right now for grants related to the three pillars that I just discussed. We want to make sure that programs, evidence-informed programs that are doing really great work to reduce gun violence in your communities have an opportunity to receive some more funding. And finally, education. So being here tonight, this is one of our goals and objectives to make sure that we can talk about what gun violence looks like in Maryland and in different communities across Maryland, and being able to talk about the policies and programs that are going to make our state safer. And this is that firearm violence data dashboard I was telling you. If we have time later, I can show you all the dashboard. It's available. I once I'm off screen, I'll share the links in the chat, both to the dashboard and also to some additional resources on our webpage. I just can't do it right now while I'm talking and I'm on this larger screen. But this is kind of generally what the firearm violence data dashboard. It has fatal data, it has non-fatal data, and it also shows proceeding and circumstances. So what leads up to a shooting fatality from the Maryland Violent Death Reporting System. The fatality data is from the Violent Statistics Administration. It's based on Chief Medical Examiner reports. And we also have the non-fatal data from Essence, which is a system that bases it on hospital check-in forms. And this has actually been a huge gap at the national level in terms of understanding not only those who have been shot and killed by guns, but also those who've been shot and injured, because it has such a large impact on our streets. So using this dashboard, we can have a look at what gun violence actually looks like in Maryland and what it looks like in different parts of Maryland, because it's not the same everywhere. As of 2024, which is our most full year of data, although that is going to change soon, we should, just in another week or two, actually have the December 2025 data up on our dashboard. Now, a small note that the 2024 and 2025 data is provisional. It's subject to change. And that is because our data dashboard developers only receive the data from the Office of the Chief Medical Examiner when that death has been finalized, when that death certificate and cause of death has been finalized. So for any pending cases, there could be subject to change. So we will have 2025 soon, so we will have updates on the dashboard. I'm really excited about that. But for 2024, Maryland experienced 671 firearm deaths, and a majority of those were homicides. Now, nationally speaking, what the data shows is that about 2/3 of all gun deaths are firearm suicides. And in Maryland, it's always been switched. So we've always had many more firearm homicides than we had firearm suicides. But I'm going to talk about how some of those trends are starting to shift a little bit, particularly as it relates to just the drastic and amazing and impressive of reductions in firearm homicides. And the other thing that I want to highlight is that 78% of all homicides involve firearms, and a half of all suicides involve firearms. So they're just the number one method of lethal means, both for homicides and for suicides. And of course, 61% of intimate partner firearm fatalities involve firearms. Intimate partner homicides involve firearms. And that data is actually from the Maryland Violent Death Reporting System, the final statistic about intimate partner violence. So this is that historical impact that I wanted to start talking about. As everyone on this call, if you've been involved in this issue for a while, you know that starting in 2021, there was a large spike of gun violence. And you can see here by this breakdown, which is the black line shows us total firearm deaths every year in Maryland since 2019. The red line shows firearm homicides, and the yellow line shows firearm suicides. And all types of gun violence had a spike in 2021. And since then, we've seen a reduction if we go through 2024. And the provisional data showing that we're still seeing that reduction in 2025. And this is mostly due to firearm homicides, and that's really important. So through amazing efforts across the state with community violence intervention programs and really targeted law enforcement and partnerships between those programs and partnerships, right? It's not just one thing. It's a collaborative effort across our state and really prioritizing this issue. So many lives have been saved. And this is obviously seeing most tremendously in Baltimore City itself. Now, what we're not seeing is that same downward trend in firearm suicides. And in fact, what we see is definitely some fluctuation and some slight increase in firearm suicide. And so that's not to say that we shouldn't still address and work toward continuing to lower the firearm homicide rate, but it's saying that we also need to be addressing these firearm suicide deaths in Maryland. And if we actually want to look at some of that 2025 provisional numbers, you can see here that in fact, by June, if we compare the first half of the year from January to June of 2025 to January to June of 2024 and 2023 and 2022, if we look at those trend lines over this 4-year period, we see that slight increase in firearm suicides. And because of this continuing significant decrease in firearm homicides, for the first time since I have been working on this issue, since 2012, firearm suicides numbers are surpassing firearm homicide numbers. And I've never seen this before. Now, again, I'm going to be that annoying public health person to just give lots of caveats to say, just remind everyone, 2025 is provisional. This is not final. So if there's some of those, if there are firearm homicide cases that are still pending, it could shift this dynamic. So I do want to be really sensitive to the nuances of what this data is showing. But I thought that it's really important that we see this, even if it starts to change. I think it definitely shows us that we need to, be prioritizing firearm suicides in addition to firearm homicides. I chose also, because of that unreliability in the pending data, I chose only the first half of the year because I thought it might, give us a little bit more of a steady picture versus something that'll be more subject to change, say in the second half of the year. Also, we don't have the December data yet. And when I pulled up the January to September of these same years to compare, we're seeing that same trend. Now here, I didn't include the incident counts because it's September. I was a little bit concerned that it might be a little bit more unreliable with those provisional numbers. But I did want to show you that those trend lines are continuing as we look at the full first 3 quarters of 2025 and how they compare to the years before. And so we've looked at some of the historic trend lines and how gun violence has changed over time. I want to show you some maps showing you what gun violence looks like in different counties and jurisdictions. This is a 5-year average. The reason that I have chosen a 5-year average, and this is on our dashboard, by the way, so all of you can find this. The reason I've chosen the 5-year average is to have as few counties suppressed as possible. So if you'll see in our legend, the gray, you see the gray with the 2 asterisks, that represents not counties that have 0 gun deaths, but counties that have rates that are low enough that they are suppressed for privacy and reliability reasons. So if you have incident counts, and honestly, I say incident counts, and we're talking about, people who have died. I don't mean to be insensitive, but data-wise, if we're talking about numbers and fatalities that are below 10, those would be suppressed for privacy reasons. So if you live in a small community and there have only been, let's say, 2 firearm suicides, if that's listed, you could potentially be able to identify those personal details. And we don't want to do that. And when we're talking with rates, those are going to be suppressed in the calculation of rates for incidents under 20. And so that's what we're seeing here. And also, I'm going back and forth a lot between rates and numbers. And so just for anyone that wants to understand, what does 3.9 mean? What does 10.5 mean? What are these rates? It's a calculation to help us understand the impact of deaths within communities that have different population levels. And so if we only look at numbers, we would always say Baltimore City has 200 gun homicides, and the smaller community only has 20. So obviously, it's more of a problem. But what if the population level in that small town were only 100 people versus Baltimore City? And so really, we would be looking at a really high percentage. And so that's why we look at rates. It's pretending that all of these populations are equal, and so that we can understand the impact within that community. And we also have to make sure that we look at numbers, because we don't want to say just because a county or a city has high population that we shouldn't worry about the people whose lives are taken there as well. So to have a big picture, we look at numbers and we look at rates, so that we can figure out which solutions and strategies we need to focus. So that's our little rate description. But we can see in terms of firearm fatality, so this would include both firearm homicide and suicide, Baltimore City has the highest rate in the county. But surprisingly, Dorchester on the lower shore has the second highest rate of gun violence. And then obviously the darker the orange, that would be, the next level. So we can see our little legend to the side. The darker the color, the higher the rate, and so on. Now, when we break that down on our next slide, we can look at the same rate heat map for firearm homicides. Again, this goes to suppression rates. So here we can see that Dorchester is suppressed, and you're actually going to see that it's suppressed also in suicides because of the population. They have just lower population. And so when you even break it down, that's going to be under the threshold of what we need for suppression. But of the counties that are not suppressed, you can see that Prince George's County, Baltimore County, and Baltimore City all have the highest rates of firearm homicide. And then this looks very different when I'm going to move to the next map, which is firearm suicide rates. And here we can see that the darkest colors, these highest rates, are going to be in the more rural areas of our state. We have down here in the lower shore, we have Western Maryland, we have Southern Maryland, and we're going to have other more rural communities, like even in Frederick and in Harford County. And that really helps us show where we need to be focused on addressing firearm suicide. One of the ways that we like to invest in our state is we have a funding program for local health departments, and we have provided funding for local health departments in counties, in 14 to 15 different counties across the state, to procure safe storage devices and disseminate that to gun-owning families and suicide prevention materials as well. And so we think it's really important not to only be present in Baltimore, even though, of course, that's where the health department headquarters is, but we're working to build relationships through local health departments so we can start to have impact across the state. And then, of course, we need to think about who is affected in terms of demographics. And this is also from our dashboard, but you can see those community members who are most at risk. And so those most at risk of firearm homicide are going to be non-Hispanic Black males, overwhelmingly so. And for suicide, it's going to be older, non-Hispanic white males. So, we need to have different programs that are going to work for each targeted community, at-risk community, different strategies, different solutions, different credible messengers. And we need to be thinking, the data helps us understand how we need to be thinking about this issue holistically and comprehensively, and adapt to each different community. And with that, I'm going to stop sharing. I think I can stop sharing. Stop share. Okay. And that is all of the data that I have for now. But I can put, now that I'm now that I'm back on the screen and I didn't want to not be able to see all of you. I can put in the chat our dashboard, and I can put a link to some of the educational materials that we've developed that you can find on our webpage as well. So we have a fact sheet on um, gun violence as a whole, all kinds of gun violence. We have a fact sheet on firearm suicide. We have one on domestic violence. And we are currently working, a little uh, sneak peek, but we are working on a fact sheet related to men and boys and the disproportionate impact that firearm violence has on men of all ages, but different types of gun violence as or I guess I chatted about briefly.
Thanks, Jen. Thank you so much for
Sure.
that overview. Yeah, and I do think actually we do have a few minutes. We're doing okay on time for a couple of questions here. I see, Gordon, you've got your hand up and you've been ever so patiently waiting.
Yeah, thank you. Jen, thanks for the presentation, and Karen as well. With respect to the death by homicide, um, how are accidental deaths by guns, if a child happens to get
Mhm.
access to one, how are those calculated and incorporated into the data, if at all?
So those are located on the firearm violence data dashboard. So you can have a selection to view. If you go here, you know what? I'll show you. How about I just show you? I'm going to share my screen again. Okay. So this is our firearm violence data dashboard. When you come to the page, the default page is this data highlights page. As I said, give us a month or so and we'll have it updated for 2025. I'm pretty excited about that. And if you go to our firearm fatalities page, you can pull down the classification for homicide, suicide, and unintentional or undetermined. So they are grouped together, but one of the reasons is because, and remember, this is giving us from 2015 to 2025. There are so few gun deaths that pulling them apart would just really have most of it be suppressed year to year for when it comes to unintentional shootings. And so sometimes what I'll do is I'll start here on the dashboard and I might just try to see if I can find news reports about them as well to learn a little bit more. Because sometimes they are going to be suppressed, particularly if you try to pull up one county. So fortunately, we have strong child access prevention laws. I know Maryland Restraint Gun Violence and Karen worked for years on trying to get Jalen's law passed to strengthen our CAP law. And MDH created, safe storage resources associated with that. And we don't have very high numbers or rates when it comes to those unintentional shootings. And so it gets a little bit more complicated when the numbers are really low because we can't share those publicly.
Thank you.
Mm-hmm.
All right. And seeing no other questions right now. I think Jen, I gave her like the permission to like duck off now if she wanted to, but I think she might be sticking around. And if you do have questions for her, feel free. And if she does end up dropping off, and you still have those questions, I'm sure we can dig into it and get them. But thank you so much for that overview. I now I'm going to go back to sharing my PowerPoint. Make sure that comes up. Okay. So now I want to connect this all back to policy because this is where advocacy lives. The data helps us identify risk, evaluate what's working, and importantly, defend smart policy when it's challenged. Our legislative priorities are not abstract. They are directly informed by what the data shows us about risk, harm, and prevention opportunities. I think that was actually the slide I was supposed to be on. So there you are. We'll move forward. So how the legislative process works. I'm going to keep this intentionally high. I know a lot of you have been doing this advocacy work in this arena or possibly other arenas for a long time, but I always do want to cover it because I always find that there are folks who would like to understand it a little better. So in Maryland, most bills follow the same basic path. They are introduced, they are assigned to a committee. A hearing is held in that committee, voted on in committee if we're lucky, and then if they survive, they move to the floor for votes. If they survive the floor vote, then they go across to the opposite chamber, and the process repeats itself until finally it hopefully lands on the governor's desk. The most important thing at this juncture is to understand that most bills live or die in committee. That is where advocacy is at its most powerful and where you can have a real impact. Advocates matter at multiple points in this process, both before hearings, during hearings, and between votes. Lawmakers pay attention to what they hear in particular from their own constituents, especially when the messages are timely, consistent, and connected to what's going on in their districts. Advocacy is not about yelling the loudest. It's about sustained strategic engagement. So our legislative priorities, I've listed them here. I'm going to go into them in more detail. Each year, we focus on a small number of priority bills. These are chosen because they are evidence-based, because they address clear gaps in the law, and because Maryland is positioned to act on them. I'm going to walk through each one using the same framework, talking about the problem, the solution, where each bill is right now, and then we'll move into what the advocates can do. Oh, hold on just a minute. I've got somebody in the waiting room. So our first priority bill is the Family and Law Enforcement Protection Act. That is SB 20, HB 83. This bill focuses on the domestic violence protective orders and firearm access. Maryland law does recognize that firearm prohibitions are appropriate in these cases, but there is inconsistency in applying these prohibitions primarily at the temporary stage. That's where the inconsistencies are, and for ensuring compliance, meaning actually getting the firearms away from those who are deemed to be dangerous. This bill creates a mandate for firearm prohibitions at that temporary stage and a clear and enforceable process for firearm relinquishment so that court orders are not just paper-based, but meaningful and protective in practice. And this matters because, and Jen mentioned some numbers about how prevalent firearms are in domestic violence situations where lethality is the end result. Domestic violence situations involving firearms are among the most lethal. So this bill is about closing known gaps and ensuring that when a court determines that someone poses a danger, the law actually reduces that risk. Our second priority bill for this session is the Comprehensive Community Safety Funding Act. This is SB 118, HB 197. This bill addresses a different but equally important problem, which is funding. We know that violence prevention and intervention programs are working, but in Maryland and across the country, they are often funded inconsistently, year to year, grant to grant. And that makes it very hard to build stable programs or plan for long-term impact. The Comprehensive Community Safety Funding Act would create a dedicated funding stream by applying an excise tax on the firearm industry tied to the profits from the sale of firearms, ammunition, and certain firearm parts. The rate would be 11%. And that number isn't arbitrary. It mirrors a long-standing federal excise tax that has existed for roughly a century. At the federal level, that tax helps offset the harms associated with hunting by funding wildlife conservation and restoration. So this bill applies the same principle here in Maryland. When an industry's products create predictable, measurable public harm, it's appropriate that that industry help fund the solutions. This is about responsibility and sustainability, ensuring that the costs of gun violence aren't borne by communities, taxpayers, or survivors alone, but that there is a stable mechanism to support prevention, intervention, and healing. Because prevention only works when it's stable, this bill is about building that infrastructure and creating it to last. And our last priority bill is the handgun roster reform. You'll see from the slide that all three of these were in different phases of development. The first one was already in hearings. The second one, we've got some bill numbers, but no hearing dates yet. This one, the text is still in drafting. So that's why you're not seeing bill numbers yet. This bill is one that we expect to spend a lot of time educating people about this year because the issue itself is not intuitive. Maryland has something called a handgun roster. In simple terms, it's a list of handguns that are approved for sale in the state. The idea behind this list was to promote safety by ensuring that handguns sold in Maryland meet certain standards. There is also a handgun roster board. This is the body that is responsible for maintaining that list and making decisions about which firearms are included. For most people, this system is largely invisible until you start looking closely at how it actually operates. Over time, the roster has not functioned in the way that it was originally intended. It was designed as a safety mechanism, but in practice, it has become outdated, legally vulnerable, and misaligned with Maryland's broader gun safety laws. Instead of serving as a meaningful safety screen, the roster is increasingly being used in ways that undermine those laws, including being used by the firearm industry as a kind of legitimacy or seal of approval for firearms that actually raise serious concerns under Maryland law. So why this matters is really simple. When a safety system is no longer serving its purpose, it actually can create more risk rather than reduce it. The handgun roster reform bill is about modernizing this system so that it aligns with current law, current legal realities, and public safety goals, ensuring that it functions as a tool for safety and not as a loophole that weakens Maryland's gun violence prevention framework. Because a system that no longer functions as it was intended doesn't just fail, it actually creates risks. Let's see, where are we on time? I can pause here if folks have specific questions about the bills themselves before I sort of jump into, how you get involved. So if folks do have questions, feel free to raise your hand. If there are none, I will start inching forward to the other pieces, but it might make the most sense to talk about the details of the bills here. Yes, Gordon.
Thanks. So don't want to monopolize time here. Curious about the handgun roster reform bill. Who is taking the lead on drafting the bill? And does this organization help with the drafting of that? I'm just curious in terms of how that process gets started.
Yeah, so bill drafting can take place a lot of different ways for different issues, when it comes to creating new law. For this one in particular, the handgun roster board is something that Marylanders to Prevent Gun Violence has been watching and tracking for a few years now, which is how we knew that there were problems. So the answer to your question is yes, we've been involved with this since the very beginning. We have been talking and working with folks at Johns Hopkins their Center for Gun Violence Solution. One of their researchers has actually within the last year or so, become a board member. So is really really in the weeds of what is going on and how broken it is. So we've been working really closely with her to try to figure out, like, are we going to keep this thing? What would it look like if we made it work correctly? So the answer to your question is yes, we've been involved. However, even once advocates might help to craft something, it then goes over to, assuming you've got sponsors, and I'll talk about that in just a second. The language, however generalized we put it together, or in this case, we actually did spend quite a bit of time trying to come up with something. It still goes to the professionals over in legislative bill drafting to figure out exactly what that looks like in terms of Maryland law. So it's sort of all of the above. The bill sponsors here are Senator Waldstreicher in Senate judicial proceedings, and then in judiciary, the House sponsor is Delegate Embry. So those are the folks that we're working with to get this thing through. And again, we've been sort of talking about this for the last couple of years with legislators. It's kind of big and messy, I'm not going to lie. And because Maryland is one of only a few states that have this roster system, it isn't the kind of thing that, like, oh, there's like a national standard and this is what it looks like. So it may take a little while to both educate on it, to figure out what's really going to work and work well. But I think we've got a good start for this year, and we'll see where it goes. There's a lot of interest. There's been a series of Baltimore Sun articles about the handgun roster board and some of the crazy stuff that's been happening. And I know it's getting the attention of leadership. So, it's possible we get it all put together and things happen really rapidly. But for those of you who've been around for a little while on gun violence related issues, you probably also know that sometimes it takes a couple of sessions to get things through. Jen mentioned Jalen's Law, and Jalen's Law took us about 5 years, I think, which is a little nuts, frankly. But yeah.
Okay, thank you.
Yeah, absolutely. Yeah. And people get annoyed with me over talking about the handgun roster board because I can go on for a really long time. So apologies if that was too much information. Anybody else have anything before we move on to kind of where you guys can come in? All right, we'll see if I can find my cursor. There we go. All right, from here on out, I think if folks have questions, feel free to raise your hand and we'll just jump in, because right now I'm just going to go over sort of, how you can help. One of the most important things I want to emphasize is that advocacy is not a one-size-fits-all situation. There are various ways that people can become involved. There are low-lift ways of engaging, like responding to action alerts. We put those out through our emails. If you've seen those before, that's basically, contact your legislator button in an email, and it pops up a pretty easy to fill out form and sample script that you're usually able to either just accept it as it is and go ahead and submit it to your legislators. Usually I try to give folks an opportunity to make their own personal adjustments to things if they do want to do a little bit more than that. So those are pretty easy, pretty low lift item. You see those coming through. We're usually trying to send those out at some key moments. So those are the low lift ways. Medium lift, calling your legislators, submitting written testimony, up to, I guess, what I would consider the high lift, giving live testimony, meeting with legislators. I know a lot of folks on this call actually regularly meet with their legislators and are always a big help making sure that folks are paying attention. And you don't need to do everything. Pick a thing and do it. Every little bit helps. And what we'll ask of you, as I said, when we ask you to take action through those action alerts, it's usually because timing really matters. A message sent at the right moment can make a real difference. Our job is to make those asks clear and manageable, and your job is simply to respond when you can. and that's it. I mean, it doesn't have to be more complicated than that. I can actually, I think I do have a thank you screen, but that's basically the presentation. If folks do have questions about any of this, I am happy to answer more questions. The Family and Law Enforcement Protection Act, which I talked about, has already had its Senate hearing and judicial proceedings. Its House hearing is tomorrow afternoon. It's happening pretty fast. I think that's a good sign for this piece of legislation. This is the second year for us working on this, and that effort has been a big collaboration between all the stakeholders that we could possibly engage to be working out this problem. So we've been talking to domestic violence advocates, law enforcement, judiciary, all of the like pieces of why domestic violence protective orders aren't necessarily working the way that they should. We've been pulling into this conversation to come up with a solution. So the fact that the bill's pre-filed, the hearings were like happening the very first week hearings could possibly happen in both of those chambers. I think all knock on wood is a good sign. And I do think that piece of legislation is in pretty strong shape. Yeah, Debbie.
I don't know if this goes to Jen, but we had separated out the suicides from the homicides. I know in Howard County, we've had several very high-profile suicides that were connected to homicides, family members who were shot and killed. Do we have any idea how common that is?
I think we may have lost Jen. I'm not seeing her on here any longer.
Okay.
I do think generally, Debbie, especially in the domestic violence setting, the homicide suicide connection is very strong. I don't know specifically how those numbers are trending in different places. I think you probably can do a little. Another source to use in the dashboard in Maryland is amazing. It's so incredibly helpful. But sometimes using it in conjunction with the Gun Violence Archive. The Gun Violence Archive is a source that does this nationally, tracks numbers, but it does it via news sources. So you're often able to sort of dig down into particular incidents a little more. And if you're looking for examples, that can be a good way to get more details, because it will usually link it directly to, and you can do searches on there, which narrow it down to the state of Maryland or make, just more manageable chunks for what it is that you're looking for. Oh, and Jen did put her email address in the chat. If anyone does have any specific questions that they'd like to reach out to her about, please do so. She's very responsive. And yeah, so anybody else have any questions? I know, I think I might be seeing a few of you anyway tomorrow with the House hearing, if people can get out of their driveway. I'm planning to like slide my car down the driveway tomorrow, and assuming that works well, I should be fine once I reach the road, right? Yeah, so anyhow, well, thank you all for joining this evening. Thank you for being engaged in this very important issue. Please do feel free to reach out anytime if I can help illuminate something for you. If you got questions, I try to give updates in our weekly emails. This session has started on a pace that has made that a little bit challenging, but hopefully I'll catch up and keep everybody in the loop. And yeah, thank you all for everything that you're doing.